Okay, so uh, today's topic is gait training. So, gait training means what? So, gait training means when you make your patient to do a physical activity like walking or standing, it is known as a gait training. So, gait training is a type of physical therapy which will help people to improve their walking, the way they walk, the way they stand, then running, jogging. So all these kind of activities will come under the gait training. So it is very important to prevent fall and to help your patient to maintain balance while walking. So gait training is the ambulatory training which we give our patient to maintain their balance and coordination while doing any kind of ambulatory activity. So, if patient is not getting gait training, there are chances that they might fall or they might go out of balance while walking or while they do their ADL activities and going from one place to another place. But if you give them a gait training, a proper gait training, it will make them strong, confident, and we can also prevent injuries like spinal injuries, then fractures, then accidental injuries, amputation. So, in all these cases, we can prevent, and patient can independently walk without any fear of fall. So, children that are in need of gait training usually have suffered from brain injuries. Otherwise, children will naturally they will start walking after a certain age. But if they are not walking and if they are having problem in walking, they might suffering from some brain injuries or neurological disorder, or there are chances of musculoskeletal issues as well. So the major requirement for a successful walking includes support of body mass by lower limb, production of locomotor rhythm. So the rhythm is also very important. If we are walking, but if it is not a rhythmical walk, then there might be some problem and there are chances that we might fall or go out of balance. Then dynamic balance. So if we are standing, that is our static balance. But if we are doing any kind of activity while walking, while standing, so if we are walking and talking, then if we are walking and doing some physical activity, so whenever we are not stable, we are moving, it will need a dynamic balance. So dynamic balance is very important before doing the gait training. Then adaptability of locomotor response to changing task and environmental demand. So it is not always necessary that whenever we will walk, it will be on a normal flat surface can be changed, like there can be some kind of highs and lows in the road. There are chances that we have some obstructions in our walking path whenever we are walking. So we have to adapt to all these changes while walking. So all these things we will learn in the gait training. So first of all, whenever we are making our patient walk, so before walking, we have to prepare them for walking. So we have to do some, we have to give them some strength training so that it will prepare them for walk. So preparation for gait training, first of all, we will do a bridging. So bridging will make our core muscles strong and even our, it will make our trunk control good enough to walk. So bridging, so here in the diagram, you can see here person is lifting pelvis up. So this is bridging. So we have to make our patient to do this particular exercise for the trunk control. Then the quadruped position. So this is the sequential exercises that you have to do while you perform or while you are making your patient to do a gait pre-gait training. Then sitting without support. So if patient cannot sit without support, how can he or she walk without support or even with the support? So first of all, sitting is important. Then when patient is comfortably sitting without support, then you have to make your patient do sit to stand. First of all with support and then progress to without support. Then kneeling position. So patient has to maintain this kneeling position for a longer duration. Then half kneeling. So this is the half kneeling in which your one leg is in the 90-90 position, hip 90 and knee 90 position, and another extremity is in the kneeling position. So this position is known as half kneeling position. Then this is the modified plantigrade proposition, or we can also call it as a plank. So plank is very difficult to do. Many patients cannot do plank, but if it is comfortable to do, you can make your patient to do plank. But I personally think that if patient can do plank, he surely can walk. Right. So if patient cannot walk properly, so it will be difficult for them to perform this plank also. Then we can make our patient stand without support. Once patient can stand without support, then you can progress to walking. Then you can progress in the parallel bar walking. Because in the parallel bar, you can have bar on both the sides. So patient can walk, patient can take a support from the parallel bar if they go out of balance any time during walking. So first of all, start with the parallel bar training and then progress to out of the parallel bar training. Then moving from sitting to standing and then reverse. You can keep a chair in the parallel bar, then make your patient sit on the parallel bar and then stand. So you can repeat this particular activity, sit to stand in the parallel bar and then stand to sit. So sit to stand to sit. You can do this repeatedly. Then you can make your patient stand in the parallel bar with support, without support, then with the eyes closed, and then with the open eyes, and then eyes closed again. So you can repeat this. So first of all, standing with support, with eyes open, then standing without support, then standing without support with eyes open, and then standing without support with eyes closed. So patient can practice this repeatedly. Then stepping. So just the stepping, just patient will take one step forward and then one step backward. So forward stepping and backward stepping in the parallel bar so that patient can take support anytime if it is needed. Then side stepping. So patient will do this kind, right? So this is the forward stepping, this is the backward stepping, and then this is the side stepping. So patient can do this side stepping and also the cross stepping. So cross stepping in the cross manner, patient will take a step, and then braiding. So how we make our hairs, the braids. So that way patient will step in the braiding manner. This way, the braiding manner, patient will take a step. Then use of appropriate gait pattern, forward progression and turning. So many times we see that patient can walk straight, but whenever it comes to a turning, it is very difficult for them. So in the progression, you have to teach your patient to turn, and you have to repeatedly do this turning for the proper experience of turning, and then patient can turn very easily without any difficulty. So use of appropriate gait pattern, forward progression and turning. So turning is a major thing which patient need to do for comfortable walking and prevent fall. Then standing balance and weight shifting activities. So before starting to walk, patient has to do a weight shifting. So on both the legs, patient will shift weight. So shifting weight will make them to be aware about the position of pelvis. Then both the limbs can take up weight of his or her body, and it will make walking easier. So weight shifting activities in the standing. Then walking over and around the object. So as I told you that it is not necessary that whenever you are walking on the road, it will be a plane. So there are chances that there are some objects around, there are some obstacles around whenever you are walking on the road. So we have to make our patient practice walking over and around the object. I saw many stroke patients, they freeze over when it comes to obstacle walking. right? If you keep a small stool in their walking path, they will surely freeze. They do not know what to do. They do not know if they can walk over that particular stool, if they can walk from the side of that stool. So it is very difficult for them to think that what to do when it comes to a obstacle. So it is like the neuromuscular problem that they cannot think what to do with that obstacle. If they have to walk by the side of that obstacle, if they can go over that obstacle, so it is difficult. And so we have to train them in the obstacle course also. Then indoor over ground progression. In that, first, we will make our patient to walk forward and backward, as we discussed earlier, then walking on ramps, stairs, and slope surface. So, as I told you, every time it will not be a smooth surface. So, we have to train our patient to walk on the slope also and stairs also. So, upstairs and downstairs, uphill and downhill, both is important in the gait training. Then walking over even and uneven surface. So if you will walk on the road, especially the on the outdoor, so outdoor you will find uneven road. So everything will not be a flat surface, right? So you have to train your patient to walk on the uneven road also. There will be a up and down slope also. There will be a stair also. So everything you have to keep in your mind and train your patient accordingly. Then you have to train your patient how to cross the spotlight, a stoplight. Because if they will walk on the road, there will be a signal, and patient has to cross the signal in a particular time frame. There will not be a forever time to cross the road. So you have to train your patient in that way also. Then walking for a longer distance, walking at a different speed, walking while uh, scanning for the objects in the environment, because it is also important to see around you what is happening. If there is some a vehicle are coming or anything like that, so you have to train your patient to see the environment while walking, checking out all the objects around you while walking, and dual task training is also very important. While walking, if somebody is calling you, it should not be like if someone is calling you, you will fall out of the balance. So you have to train your patient that patient will walk, and along with the walking, he or she has to do the another activity. So walking while talking, walking while checking out the phone, or walking while catching the ball. You can train your patient this way also. In your clinic, you can ask your patient to walk and then you throw a ball towards the patient. So patient has to concentrate on the ball which is coming towards him, and he also has to continue walking. So this is the dual task. So patient has to complete both this task in a particular time frame. So dual task training while walking, then walking in the open environment and in the distraction. So uh, you must have seen that the small child, whenever they start walking or whenever they start learning bicycle, if you will call them, they will fall, because it is a kind of a distraction which they are facing. And whenever they will have a distraction, they will fall out of the balance. So we have to train for this particular problem also. So our patient has to face distractions. So while walking, you can call your patient. While walking, you can throw a ball towards the patient, but it should not be like it will harm the patient, right? But it should be like patient will feel a distraction, and patient has to control their balance with that distraction and continue walking also. Then running and jogging. So this kind of gait training you can give your patient. This gait training will help them to maintain balance, to become ambulatory and performing their ADL activities. Then you have to ask your patient for the particular gait, that the normal gait pattern, and patient has to follow the normal gait pattern. that double limb support time, single limb support time, all that time should be maintained. That it should not be like the double limb support time has increased and the single limb support time has decreased. So patient has to walk in a particular gait pattern, and that normal gait pattern should be followed. So you have to see that also, that patient follow the normal gait pattern. Then you can ask your patient to walk against resistance. So this is the resistance training which you can give to your patient. Like you can make your patient to walk in the pool. If pool is available, pool walking is a very ideal environment for the patient, because if patient will fall also, they will not get any injury. They will not get injured. So pool walking is important and the very ideal environment for the patient to do a weight training and this strength training in walking. Then patient can walk against the resistance band. Like it is seen you can see here in the picture, patient is walking with the resistance band in the foot. So patient can walk this way with the resistance band. It will also give a strength training. Then walking backwards. So retro walking is also important. Retro walking is very important in the TKR patient, total knee replacement patient. So it will improve knee extension. So if patient is not having a full knee extension, you can give this retro walking to the patient. Then patient can walk on the foam surface. Patient can walk on the hard surface. Patient can walk on the grass. So you have to make your patient to face each and every difficulty which we face in our daily routine. Then only our gait training will be proper. Then visual input. So you have to make your patient walk with eyes open and also with the eyes closed, because if patient is having difficulty in eyes closed, there are chances that patient might have some proprioceptive issues, and there are chances that sometimes we do not have proper light. For example, if we have to walk in a very dark night without any light, so it is very important that your patient can walk with eyes open and also with the eyes closed, and patient has to maintain balance while walking closed eye also. Then walking while moving head. So it is also important walking with alternative head movement. So you have to call your patient whenever your patient is walking. You have to call your patient from the side, from the behind, from the another side. So this way, patient will perform a head movement while walking. Then this we have already discussed dual task training, walk and talk, walk and count by trees, walk and bounce or toss a ball, carry a tray. You can give anything in patient's hand and patient will carry that particular object and walk. So then you can progress to treadmill walking with the different variety of speed, and suddenly you have to ask your patient to stop. Then suddenly you have to ask your patient to walk. So everything this is the part of your gait training. So this is the gait training which you can give your patient, whoever is having difficulty in walking or walking re-education. Thank you.